Well, the abdominoplasty or tummy tuck is an operation to remove excess or residual skin of the lower abdomen. This can be done either as a small procedure called a mini abdominoplasty, where you just have a small overhang and a short scar results in the bikini line. In this case, there is no scar around the belly button. More commonly, however, what women are wanting, or men in some cases, is removal of the skin from pregnancy, from massive weight loss, which accumulates below the belly button, and all of that needs to be removed. This results in a scar which will extend from one hip joint to the other hip joint in the bikini line, as well as a scar around the belly button, as this has to be repositioned in the midline. Any patient who undergoes an abdominoplasty needs to be aware that this particular procedure relies very much on blood supply to the very end of the abdomen for it to be a success. To that end, I would say the single biggest advice I can give to anyone is just to stop smoking. Smoking in the lead up to surgery as well as during surgery undoubtedly has a significant effect on healing. And we all want a good outcome, both the patient and the surgeon. But certainly with smoking, cessation of smoking and also a maintenance of weight is vital. The best results are achieved in somebody who is within the normal weight range, not only for the patient but also from the surgeon. The ability to contour the end result is far easier if the patient is of normal weight. I would also say that patients should avoid taking aspirin or any medication such as ginkgo biloba, vitamin E tablets, and even garlic, as this may affect the bleeding following surgery. The patient following an abdominoplasty will experience a number of features which are common to this procedure. The first one being the fact that clearly that the tummy is a lot tighter. So they will wake up in bed with a pillow under their knees usually, and they will notice that over the next few hours, the skin of the new skin of the tummy will stretch to the level where they'll be able to start walking. And this is something we in fact encourage the day following surgery. So the patients are not kept in bed for longer than 12 to 24 hours at the most. There will be two drains, which we use, one either side of the abdomen, and this will drain any clear fluid or any blood which may still be remaining after the surgery. The operation, interestingly, is relatively pain-free because the nerves have been temporarily put out of action due to the surgery. But what the patients really do notice most commonly is just purely the tightness of the abdomen, which ultimately is the aim of the procedure. The risks following an abdominoplasty commonly relate to the early risks and the late risks. The early risks would be those associated with the operation. These include the potential to develop clots in the legs and clots in the lungs, but we go to a lot of effort to identify patients at risk, and we give them a suitable treatment beforehand for that, or preventative measures to stop that from happening. But relevant to the surgery itself, the potential for bleeding, developing what's called a hematoma, infection and wound problems, especially in the midline, is there. Again, I would emphasize the importance of smoking as a risk factor developing problems in the midline of the abdomen. Long-term problems, the single most common problem that I've seen is just the residual, what we call dog ears. There's a little bit of extra tissue on the edge of the scars, which are usually always easily removable under a bit of local anesthetic as an office procedure. Occasionally, about 5% of patients have a little painful swelling in the midline of the abdomen usually, and this is called a seroma. This is a collection of clear fluid, and again, this can usually be easily dealt with in the office by putting a small needle in and removing clear fluid. Patients need to be aware that following an abdominoplasty or tummy tuck, there is a period of time that they will need to be off work. This varies anywhere up to 2 to 3 weeks. I normally say, although they are up and about and walking within the first day or so, they need to take great care, and I would say at the very least a period of a week to 10 days off work with a gradual return to work thereafter is necessary. Patients should expect a period of up to 6 weeks before the wounds have healed fully and they can return to normal activities, which include going back to the gym.